Dr. Manderson, I asked you previously about the risk of myocarditis because you claimed to pilots that there was a higher chance of myocarditis from getting COVID than getting it from the vaccine. I provided you with a systematic review that refutes that. It's entitled COVID-19 Associated Cardiac Pathology at the Post-Mortem Evaluation, a collaborative systematic review. It was published in the Clinical Microbiology and Infection Journal for 23rd of March 2022. I asked you to provide me with what evidence you had to base your previous statement about myocarditis on. That was in SQ 23004809. You undertook to provide that evidence that you had, but in the answer you simply referred to the TGA, deferred rather to the TGA. Not evidence you had assessed to make the comment you made. I'd like to ask, did you write the answer to SQ 23004809 or did CASA officials?
Excuse me, Senator. I think we provided a follow-up answer to that, and we advised that the response was provided consistent with the requirements of the standing orders around responding to Senate estimates questions.
Who did you provide that to, Ms. Vance?
That was the answer to 00268 from committee question number 254.
Who wrote the first response?
Senator, I don't think it's actually... The question is directed to the Civil Aviation Safety Authority, and the Civil Aviation Safety Authority provided that response, and that's consistent with the,
who wrote this,
guidelines for officials.
The guidelines to officials?
I approved the response.
The guidelines do responses that the government has just put out?
No, these are the... date back to February 2015.
Okay. So why...
I can table that response if that would be helpful for you, Senator.
Yes, please. Won't get through it now in the interest of time. One of the studies provided by the TGA in what you referenced was Husby and et al. It's entitled Clinical Outcomes of Myocarditis After SARS-CoV-2 mRNA Vaccination in 4 Nordic Countries, population-based cohort study. Do you still stand behind that evidence to say that the incidence of myocarditis is lower?
Dr. Kate Manderson, Principal Medical Officer at CASA. Yes, I do.
Thank you. When you actually read that study, it says that 9 of the 109 patients were readmitted to hospital after COVID myocarditis, while 62 of 530 were readmitted after receiving vaccination myocarditis. That's 8% for COVID myocarditis and 12% for the COVID vaccine myocarditis. More people, as a percentage, were readmitted to the hospital after the jab myocarditis than after getting COVID by a factor of 50%. The evidence you cited doesn't appear to support your statement that there's a higher chance of myocarditis from COVID than the vaccine. Can you explain your contradiction?
Senator, I'd like to make a point before Dr Manderson answers that question. I'd like to make an important point before Dr Manderson answers that question. We have tried to explain on a number of occasions to the committee that CASA's role when it comes to vaccinations is purely related to aviation safety. And I can tell you again today that there is no link to aviation safety from the matters that you're talking about. So while Dr Manderson can express her medical view about the questions you've asked, they actually have no bearing on CASA's role and CASA's remit when it comes to vaccinating the population.
They have an enormous bearing on Dr Manderson's integrity.
Senator, I think that commentary I find quite disappointing coming from a senator, but we will allow...
The questions do appear to be out of...
Sorry, you'll need to come a bit closer to the microphone. I can't hear you, Senator Brown.
Senator Roberts' questions do seem to be out of... not for CASA. They're not part of CASA's core duties, so they really need to be asked in another...
Minister,
in another committee. He's asking about...
hang on. Just let the Minister finish.
Okay, so I'm asking the Chair to rule whether the Senator Roberts' questions are in order for CASA.
Chair, I would point out that we have received hundreds of calls from pilots.
Yeah.
We've received emails, letters, we've had person-to-person conversations, and pilots from both Qantas and Virgin are absolutely terrified of what the injections are doing to some of their pilots. This is a fundamental thing, and it goes back to Dr. Margelis some time ago, and also to Dr. Manderson.
Make a comment. Okay. You make a quick comment?
Yeah, I do, because nothing the Minister has mentioned goes to the standing orders, that anything that Senator Roberts has asked is in breach of the standing orders, and therefore he has the right in this committee to ask public officials who earn a lot of money, more than most of the people around this table, to answer the questions on behalf of the constituency that he represents in this place. And I would ask that the officials are very experienced and are very patient and will be able to respond to Senator Roberts' questions.
Okay, well, we've got to keep going with the line of questioning, but I was also going to say that if there were any particular areas, as you would know, as experienced officials, that do flag that, obviously with us here, that if you feel like it's better relevant to be answered by another agency or another department, but you know, I don't think it's our role also to tell senators what they can and can't ask, but we're going to leave it to your judgment as well too. But I think the Minister's concern is that maybe some of these questions may be more appropriate in another committee throughout this fortnight of estimates. So, but anyway, let's continue. Senator Roberts, you have the call. Let's just continue.
Regardless of what's in that study, is it your academic opinion, Dr. Manderson, that a collaborative systematic review can be completely nullified by a single population-based cohort study?
A single population-based cohort study is one piece of evidence within thousands, many thousands of pieces of evidence that have been published around COVID-19 vaccines and myocarditis related to that. It would be scientifically and academically incorrect to rely on a single study or even a single piece of information within a single study to be selectively reported and base an entire policy decision or clinical opinion on that cherry-picked, if you like, small piece of information. It's a really fundamental part of research and critical analysis that you understand the breadth and the depth of clinical information that's reported in the literature, how that the reporting is done, and even understanding the fundamentals of analysis of individual articles relating to things like sources of bias and sources of statistical significance and relevance in that sort of thing. So no, a single study should never be relied on, and a single piece of data within a single study should never be relied on. It is the breadth of information from a range of clinical literature, as well as its interpretation and application. It's called the concept of generalisability and applicability to a population study as it applies to a group. When you're forming an opinion using that information as to how it applies to your cohort.
Thank you. Thank you. I understand all the terms you use, believe it or not. So you didn't answer my question. You went around it with a lot of terms. Is it your academic opinion that a collaborative systematic review can be completely nullified by a single population-based cohort study? Which would you put more credence in?
So a collaborative systematic review, sometimes we call those meta-analyses, given more weight in terms of evidentiary power, I suppose, than a single study. The more data points you get from the more studies that are published, that are analysed, the more reliable the evidence will be.
So you don't think a systematic review, which I provided, trumps a cohort study in the hierarchy of research?
A systematic review is as good as the review process is done and the way in which it's done. So there are important academic guidelines on the way systematic reviews should be done, and that goes to the inclusion criteria for the articles that they refer to, the way they analyse the data within the articles that they've referenced, that they've selected to include, and the way that they have controlled for selection bias in choosing those articles. So there are systematic reviews that are...
Single article-to-article comparison. Which is more valid? Which carries more weight?
Unfortunately, it's not as simple as that. A poorly conducted systematic review is not as good as a well-conducted cohort study.
Given equal quality, which one carries more weight?
If they're both conducted with great quality and equivalent quality, then a meta-analysis and systematic review of multiple data points is better than a single analysis if they are done with the same level of quality.
Thank you. Now, next question is that none of the studies you referenced from the TGA were actually published at the time you made your statement to pilots about the risk of myocarditis. Did you actually have any evidence at the time you made the statement to pilots in February 2022? That's what I asked. What evidence did you have? Nothing in your question or notice was available at that time. Nothing. So what did you rely on?
So by 2022, there had been tens of thousands of research articles published into COVID vaccines and the relationship between those and any adverse cardiac events. In particular, very large studies coming out of the countries that adopted COVID vaccination quite early, in particular Hong Kong and Israel, published a lot of data. That research was published in globally...
Excuse me, Dr. Manderson.
Senator Roberts, sorry, but we should allow the witness to
She's
conclude her answer.
Okay.
It doesn't matter,
Keep going.
but just hear her out, and then you have an opportunity to ask her another question.
So that evidence was published in globally highly regarded journals, the Journal of the American Medical Association, the New England Journal of Medicine, the British Medical Journal Cardiology edition, the Lancet, and the publications from the United States Centers for Disease Control and Prevention, the CDC. Those source articles formed the basis of the advice that was provided to medical practitioners in Australia by the National Health and Medical Research Council, the Therapeutic Goods Administration, and the advice from the Chief Health Officer of Australia and the public health authorities of each state. So in 2022, all of that information was available, and all of that information leading up to when I did that webinar was what I based that on.
So your diversion is classically known as an appeal to authority. You put so many appeals to authority and they're very, very clever. But I asked you a question. At the time you made the statement to pilots, that's what I asked. And you gave me a reference that was not available at the time you made that statement. So I asked you just now, what evidence did you have specifically when you made that statement to pilots? And secondly, nothing in your question or notice was available at that time. Why?
Ms Spence wanted to add something just before too. Ms Spence?
Yeah, look, Senator, again, it goes to the direction that we're going in with the conversation, and I totally respect the importance of you being asked to ask the questions, but I would like to put it on the record that every other country, every other national aviation authority took the same approach that Australia did. We did not work in isolation in this space. And I hear you're talking about the information and discussion that Dr Manderson had with the pilots, but I'm struggling to understand what the specific issue that there is around the actions that CASA took during COVID, which to me would seem to be a far more important issue to get to the heart of. If you thought we'd done something wrong, something different, something unacceptable, I'd like to have that conversation rather than a very detailed academic conversation around which of the 1,000 articles that were available at the time Dr Manderson relied on.
Sorry, Chair, can I just add? I just stress Senator Mackenzie's point here. The witness is fine to raise a point of order, but it's got to be any claim not to have to answer a question has to be grounded in the standing orders and precedent practice of this Senate. And nothing you spoke about there, Ms Spence, did that. So otherwise we're just giving opportunities for people to cover themselves to avoid answering questions. I think Senator Roberts' questions are perfectly fine. They're about public statements made by witnesses, and that is definitely able to be asked about at Senate estimates inquiry.
Yes. And I think, Ms Spence, not to sort of summarise, but I also am mindful of time. I don't want to spend too much time on this, but I think the point that Ms Spence was trying to make was that, look, happy to keep answering questions from Senator Roberts. I don't think that's in dispute, but I think she was just trying to see if there's more valuable time, or with the time we have, in helping Senator Roberts answer his other questions. But can we just keep continuing? Because, and I don't know where we left to, but Senator Roberts, did you have another question for the witnesses before us?
Yes, I do have lots of questions.
Yeah.
Ms Spence,
Senator.
you, Dr Margellis, and I think Dr Manderson have all said that the ultimate responsibility for aircraft safety in this country is with you three. With the COVID injections, that's where this all started, it's with you two. And specifically, Mr Margelis, you told me in one of the Senate estimates responses that Dr Manderson is the chief medical expert. That's where I'm going. Is that clear?
Is there a question there? Sorry, Senator.
I'm responding to your comment. Was I clear?
I'm sorry, Senator. I still really don't understand the direction that you're going in.
Okay, you don't understand safety. All right. Well, let's continue. Ms Spence, I've asked CASA in November 2023 to do a search of the medical record system in question SQ 23004943 for key conditions, and you told me that was not possible. Now, that's not true. CASA can do a free text search of your medical records system for key terms and report the amount of times the word appears. In fact, you did exactly that in a February 2023 question on notice, SQ 23003267, where you told me that, quote, during 2022 there were 27 instances of pericarditis or myocarditis mentioned in the clinical notes from medical certificate assessment, end of quote. Have you misled the committee on whether CASA can do a search for the terms I've asked for in the November question, given that you actually did that in February?
Senator, if I recall, I answered that question. And what I told you, and I stand by today, is that our medical record system is not designed to capture those specific conditions and diseases in a way that reporting would be meaningful. So while we could search the free text comments of our medical record system for those terms can appear in free text because a patient mentions them in a consultation, because they believe they might have it, because of an actual diagnosis. So we stand by the evidence we gave, which is that our medical record system doesn't capture information on those specific diseases in a way that can be reported meaningfully. And if you'd like to give me the reference of your question, I can reiterate the answer that we gave.
It is possible to do a search in your database for the words I've asked for in SQ 23004943, like you did in SQ 23003267. I understand your comments. And you can provide an answer for how many times they are mentioned in the clinical notes from medical certificate assessment in 2022 and 2023. I'd like you to take that on notice and to provide it.
Senator, if we do that, it won't be meaningful, but again, we'll take it on notice. But I think what now I'm calling you a doctor. Congratulations. Mr Marcellia was saying was that any reference would pick up, but it doesn't mean that it's actually related to that particular condition. So,
and if I've got 4943 in front of me, Senator, and at the end of that question we say providing the information requested would require a collation of free text information from tens of thousands of records and would be an unreasonable diversion of resources.
Okay, thank you. Has CASA been provided with the guidebook circulated by the Department of Prime Minister and Cabinet giving advice on how to answer questions on notice?
Not that I'm aware of, Senator. Certainly not drawn to my attention. I did hear the questioning yesterday, but I haven't seen the circular that was referred to.
So, when we go back to my first question of Dr. Margelis on what authority... Sorry, did I mispronounce your name?
It's Mr.
You've promoted me to a doctor, thank you, Senator. But Mr.
Is that a promotion? Mr. Margelis, on why, under what authority Qantas and Virgin injected their pilots with an untested gene therapy-based treatment that had not been approved by the TGA, not done testing by the TGA, nor by the FDA in America. You said you relied upon experts. I said, which experts? You said experts. Which experts? Experts. Which experts? Experts. And then you said, when I said which experts for the fourth time, I think it was, you said international experts. Dr. Manderson, which experts' advice did CASA rely upon for turning an eye away from the mandated injections of healthy pilots with the COVID injections?
So, Senator, I'd like to correct the statement you've made, because what I recall, and if you tell me the date, I've got the Hansard in front of me. What I recall telling you was that we had no role in intervening in the Australian government's public health response to COVID, and we did not intervene to prevent the vaccination of pilots, just like we do not intervene in the prevention of any other administration of any medicine or any vaccination. So if a pilot was to have an adverse reaction to a vaccination, the aviation safety response to that is that that pilot excludes themselves from flying. So that's what our procedures are based on. We have no role in intervening in public health responses, mandating or not mandating the administration of vaccinations or any medicine for that matter.
The Prime Minister, Scott Morrison at the time, said every night for about a fortnight there are no vaccine mandates in this country. Now that was a lie. But what I'm asking you is not whether or not you're going to interfere in a vaccine mandate. What I'm asking you is what were your reassurances that these vaccines, these injections, would not be unsafe to pilots? Did you do any high-altitude testing?
Senator,
what are the results of that? I'm asking Mr Marjaz.
And Senator, as responsible for the organisation, we treated the COVID vaccinations the same way that we treat all vaccinations. We do not do our own independent testing. What we do ensure is that the system works, that if there's an adverse reaction, then the pilot would not fly.
So
and can I be very clear here, Senator, and as we've said, I think at the last 5 hearings, there has not been internationally any evidence of any pilot being incapacitated as a result of a COVID vaccination while on duty.
There are 1,000, I was told by a lawyer working with Southwest Airlines in America, 1,000 pilots cannot pass their medical since getting their COVID shots.
That's not what I said, Senator, was that there has not been a single example of a pilot being incapacitated on duty as a result of a COVID vaccination.
Senator, if you've got more questions, I do need to move the call around.
I have got some more questions, but if you move it around and come back to me, that's fine.
All right.